Right, thank you very much indeed, Bob. It is absolutely great to see you all. Thank you for coming along tonight. Cedi and Ed are good, close friends of the Leaders Club, both members over a long period of time. Cedi is a polymath. I don't know how he managed to do so much. Currently, amongst other things, he's chair of NHS Kent and Medway, having previously chaired North Middlesex University Hospital NHS Trust. So he's got a major role and responsibility there and is seeped within the NHS. Ed Clinkett is, I have explained it before, is an IT guru. A year or so ago, Ed did a remarkable presentation on a product he created called Creating Hyperreal Digital Versions of You, based around the fashion industry. And it was a real eye-opener, an extraordinary thing. But what Ed has now done is turn his mind to the issues and challenges in the healthcare marketplace. So the product is called SeeYoo, and it's titled underneath Reducing Health Inequalities and Saving Lives. We're looking forward to learning more. Over to you, please.
Thank you, Steve. I'm going to speak first. So can I just introduce myself? I'm Cedi Frederick, and thank you all for giving us the opportunity to just share with you a journey that we have been on. And Ed will talk, I presume, at length about some of the technical things that we've been involved in, but I'd like to maybe use the first 2 or 3 slides just to give you some background. So if you could have the next slide up, that would be great. So, like a lot of individuals, we all had a fairly difficult pandemic. And from my perspective, it was my involvement in the NHS, chairing a NHS hospital trust through perhaps one of the most challenging times in our collective history. Ed will talk a little bit about his personal situation, but basically I've known Ed for several years, and we were talking through the pandemic about our frustration with how difficult it was to get the system, the technology, to work in a way that made sense. So between us and with our colleague Roy Williams, who's actually based in Trinidad in the Caribbean, we started thinking about how we might be able to create something that would make the whole journey, the patient journey, the user's journey, much more seamless, straightforward, and put them in control. That led to, and we haven't got time to go into the actual steps that led us to this point, but it led us to create a company called Conciliaris Digital Systems and create what we believe to be a unique digital health platform. On the screen there, you'll see the team that we put together. Ed, Roy, and I founded the company, and since then we brought in other people to provide advice and support. And there are a number of people who are not named there who made a contribution in the early stages of our journey. So next slide, please. As the company has evolved, as our thinking has evolved, we now recognize that our ambition for SeeYoo should be limitless, should have no bounds. So this is our vision and our mission. It is ambitious. Some might say we're tilting at windmills, but we believe this is where technology can serve humankind. We can debate long and into the night about actually how much of technology helps humankind, how much of technology actually gets in the way of relationships, conversations, and the like. But from our point of view, we want to harness our technology to serve humankind. Next slide, please. We started the journey thinking about how we might be able to improve how the NHS works. But to be frank, we soon realized that just talking to the NHS, and I'm someone who's deeply embedded in the NHS, who's 100% committed to the NHS, but when it comes to technology and digital, the NHS has already started on its own journey. As we spoke to more and more people, it was clear that we would spend the next 2, 3, 4, 5 years trying to work with the NHS, get the NHS to understand what we're trying to do. And it's actually just through our continued conversations and our own personal backgrounds and stories that we realize, actually, you know what, SeeYoo could do much more. And our focus has turned to the developing world, and in particular to Africa in the first instance. We'll talk a bit later on about some of the early discussions we're having with a number of health ministries in African countries. But the more we researched the health sector, or the lack of the health sector in Africa, we really believed that actually SeeYoo can really make a difference. It's a game changer. There's no question about that. It's not my style to read slides. You can read those for yourselves, but just to perhaps just illustrate the fact that Africa as a continent is a remarkable continent. I think we understand that and know that. But when it comes to understanding the health needs of its population, it has a long way to go. It doesn't have the data. It relies very much on word of mouth, writing things down on bits of paper, and anecdote. So we believe that we can make a contribution to support Africa to establish a very sophisticated health system to help countries in Africa improve the health of their populations. Next slide, please. This slide just gives you an indication of the scale of the challenge and how things are done at the moment. For the reasons that we all know, the health of the nation in many parts of Africa is not where it needs to be. And despite all the efforts of voluntary organizations, NGOs, and national governments of every size and stripe, they still have a long way to go. The photograph on the left there shows someone effectively working in an environment that is how things happen in America. Small groups, word of mouth, hoping people retain things. And similarly, on the right, you see just people working really, really hard in small communities, trying to get messages across to people, trying to gather data, and then moving on to the next village or the next town to do the same. The scale of the challenge in Africa, and it won't surprise you to understand this, is vast. But we believe that we can make a significant contribution. Next slide. And I think at this point, do I hand over to, no, I don't. So Ed will talk a little bit, or talk a lot about the technology. But our ambition in Africa and elsewhere is to take our technology into communities, co-produce the detail of what is needed, and to enable local people to take much greater control of their health. Next slide. What this slide tries to show is, in a post-COVID era in developing countries, we know, and it's the same over here, countries are struggling to recover. Health systems around the world are struggling to recover. A sophisticated health system like ours in the NHS, but also right across the developed world, are struggling to recover. Imagine how challenging it is in underdeveloped or developing countries. We have lots of data. One thing the NHS, Public Health England, and others did through the COVID period was gather data on a minute-by-minute, hour-by-hour, day-by-day basis, analyze that data. It helped scientists, public health professionals, and others focus their attention, direct their resources to deliver. That has not happened in countries across Africa and the developing world. Next slide, please. from our point of view, we understand and we've gained a lot of knowledge around where the needs are. Capturing data, analyzing it, and gaining insight is almost impossible across the developing world. SeeYoo, as we will now share, is very much about the way that we'll overcome that. Ed?
Thank you. Thank you, Cedi. Thank you, Stephen and Bob and everyone. I'm not going to go into too much tech and geek talk because I'm the geek in the room, but it's an honor for us to share this concept with you. As Cedi alluded to earlier, what we're trying to do is solve a few problems around access to healthcare and using technology to make it easier and more trusted in terms of data capture. And I'll talk a bit more as I progress through the slides, but essentially SeeYoo is a new health experience that gives patients and healthcare practitioners a simple, integrated data capture tool and a triage capability. And this idea was born just at the beginning of COVID. Just to give you a little bit of context, I had an issue with my youngest daughter, and just as everything got locked down, we were struggling to get her to see our local GP, and it was just a nightmare to take pictures of the condition. She was suffering from severe eczema, and trying to get pictures uploaded to the doctor's system. He couldn't see them, couldn't download them. Eventually we did kind of like a video call, which I had scanned using my phone, my daughter's hand, and showed it to the GP via video call. And it dawned on me that there wasn't a solution out there that made that process easy, but equally got me thinking about how can we, in this new world where things will lock down and pandemics will impact our daily lives, how can we trigger or start the health conversation with a practitioner or a clinician? And so I started sketching a few ideas, and SeeYoo was born. What it does is it literally gives you a new way of starting your engagement with a health specialist. And I'll tell you this scenario first, and then we'll talk a little bit about the other side of SeeYoo, which is empowering practitioners in rural and developing areas of the world. But the first scenario is, if we imagine we need some help at any point, 24 hours a day, 365 days of the year, we typically have to pick up the phone, call a service, and book some time and eventually get access. With SeeYoo, what we've done is we reversed that process and said, okay, you are able to create a 3D scan of yourself. We get it measured. We track some initial biodata from you just by asking you what your weight is. We can extrapolate through AI what your body mass index is and whether you sit within it. When you register with us, we collect information or talk to systems, and we pull your history as you are responding to the questions on the app for whatever condition. And in the example you just saw in the video was somebody clicking with the chest pain. The app will check your previous health record and see if you've had this experience before, but largely it will prompt you and ask you questions in the same way that if you went to an A&E department or you were speaking to a doctor, they'll ask you a series of triage questions to ascertain the severity or the urgency of your condition. We've taken that same principle, the same kind of questioning. The questioning follows strict MTS 3 standards and other clinical standards, so that we can make sure that we're not just asking questions for the sake of asking questions. All of that data is integrated securely to back-end systems, electronic patient records, other systems that a GP or a practice would use. But what we're doing is we are feeding new data to those systems and allowing the doctor to look at the results very quickly and ascertain what the next steps should be. The smart thing about SeeYoo is it prompts the doctor or the practitioner in the back end to call you back immediately. So you don't have to wait, book an appointment, call reception or whatever. And you know, the app is smart enough to trigger a call back from the doctor. That's we're going to call it developed world scenario. The second scenario for SeeYoo is one that we are focusing on in the first instance of the product launch, is trying to, I guess, I'm not going to, sanitize is probably not the right word, but capture real-time health data that's meaningful, that is accurate at source, to solve one of the biggest problems in developing worlds, which is universal health coverage, right? It all stems around understanding the condition of your communities, your patients, your population. Currently, everything is done on paper. Communities are visited by a practitioner that's armed with a folder. In that folder, there are multiple records with the risk of being mixed, lost, damaged. So what we've done with the app is designed a section of the app that we just hand to a practitioner. They can attend a community. They'll have access to data that's already pre-populated and continues to be populated by every visit. But crucially, it also manages a schedule of events and consultations on site. So it gives them, in the middle of the screen here, you've got 3 phones. The middle one is effectively an appointment manager of who that practitioner is visiting at that point. As soon as they click on one of the tabs, it loads the data across, pulls the information of the patient that is going to be consulted on. And in the scenario that you're going to see in the next slide is effectively somebody visiting a rural community. They have the data about the community overall, but crucially, one of their patients that they need to see is pregnant, young woman. They can see initial quick indicators, but at that moment in time, she goes into labor, right? Typically, you'd complete the labor, write everything down on paper, weigh the baby, etc. With SeeYoo, we capture that as soon as the labor is completed, she can scan the child, enter some very basic data points, and the record of the child is automatically connected to the mother for life. So there's no way of losing those records, losing that information as the practitioner visits the next community or returns back to base. So what we've done is we've managed to eliminate one of the biggest pain points in having data about births and a few other elements that are scribbled on paper and potentially lost, right? Now we start building a digital record with real-time health data and metrics that can help any government or clinical institution manage the delivery and provide and access to healthcare services, right? And in the back end of SeeYoo, which I'm going to show you in a second, is literally the engine that consumes all of the data from the mobile devices and turns that into two sectors. One is the information, which is information display, which is just reporting, giving you a quick view of the general health status of the population, allowing you to preempt potential conditions, potential alerts on pandemic outbreaks, general injury types, etc. So the next visit, or you can plan a follow-up visit armed with the right medication or the right clinical assistant and or specialty treatments. It also serves a dual purpose for hospitals. They're able to see capacity and manage the provision of the right kind of skills for depending on the volume of certain types of conditions that are feeding through the doors. The next slide is essentially a video of SeeYoo in the background, SeeYoo Medic in operation. And what we're seeing is a scenario where somebody is managing hospitals' resources, for example, so they can see capacity that they have, they can compare that against common issues that are affecting the community, but equally, they're also able to see a list of patients that are due to be seen, and every patient that goes onto the platform is fed from the app. So the data that's collected on the app is fed in real time to the backend platform, and the doctor or clinician is able to see the results of the answers that a patient would provide, and easily, very quickly book them in for a quick appointment or an emergency care, or whatever they deem right. They can also, through SeeYoo, because we integrate with multiple other systems, is pass information about that patient across to departments. Currently, in established and developed worlds, you have 5 or 6 different computer systems to jump from one patient record to another patient record to move them across a department. In SeeYoo, it's just one, right? You move the patient across different services. You're able to speak with previous consultants or practitioners that have been involved in that patient's journey, make recommendations, have discussions, and then conduct a physical appointment with the patient to then diagnose and provide the correct acute critical care or non-critical care that's necessary. The one thing that SeeYoo does from the medic side is it brings together the capability that I don't know if you're aware or have experienced this before. If you visit a hospital in one area and then you go to another area and you visit another hospital, the doctors in both of those hospitals have no way of recognizing your history other than a very top line summary that's probably presented, and depending on how you get to the hospital. With SeeYoo, every hospital that has a system will be essentially have access to that patient list for the region and for the community. So any doctor can jump in at any point in time, see the history of a patient, speak to the previous health practitioner that assisted them, compare notes, have further discussions. There's no jumping around and waiting for your records to be discovered and brought back up. So that is probably one of the elements that is unique in that it provides clinical collaboration across departments in a hospital. The next component to SeeYoo is an actual physical booth that we've designed, which is a larger mobile version of a private booth that we can spin up, and it runs on solar power. Very low footprint in terms of energy consumption. The software is essentially the same as on the mobile, but crucially what it does is it enables multiple languages to run on it, but any patient in any location can walk into the booth and conduct a triage in the same way as they would on the mobile phone. And this is particularly relevant where there are people that don't have mobile phones or are not manually dexterous or don't have a limb, etc. There's voice recognition imprinted into the software across the piece. The triaging model is exactly the same. All of that data that's captured in the booth in a few seconds is sent to the backend SeeYoo Medic, which allows then a practitioner, clinician to make decisions and and effectively interact with the patient. They could be miles and miles away in different locations. And this is one of the things that we are aiming, is probably the right term, to introduce into the developing world, given that there are a lack of physical institutions, hospitals, clinics spread out remotely. Any practitioner can, and you'll see in the video that I'm going to play in a second, the whole SeeYoo concept is mobile. It's designed to be portable and located anywhere in the world, without great dependency on energy infrastructure and others. So I'm just going to run the video, which gives us a scenario. You'll see the mobile capability of SeeYoo, the SeeYoo booth, but equally it tells a story. And I'll zip up for now and just watch the video, and then happy to take questions after. And that, ladies and gentlemen, was SeeYoo. Thank you very much. Hope I didn't get too techie, but I'm happy to answer any questions.